Hi guys, it's Tamara coming back at you with another video. Welcome back to my channel. We're going to go ahead and talk about what trauma therapy is. So we're going to start the new week off by talking about what trauma therapy is. I've noticed that a lot of my clients, they come to me because I am nationally certified as a therapist, and I do some international work as well with people overseas. And so most of my clients come to me and they're like, Tamara, can you please help me understand, like, what is trauma therapy? And I'm like, you don't know what that is? And they're like, no, we've never really heard about it. And so I've realized after 11 years in this field, a lot of people are very confused about what trauma therapy is. So I take some time, usually about 20 minutes of a session, to explain what trauma therapy is, and we do some activities based on a trauma therapy model. So I want to talk a little bit to you about that today, because I think it's going to be a good start to our final conversation, which is going to be two pieces. I'm going to talk about how to heal from trauma, and I also want to talk about post-traumatic growth. So that's coming up next week. So I figured this would be a good video to kind of get us to the final week of this series on trauma. So the benefits for you today in this video is that you're going to be able to learn just a little bit more about trauma therapy, and you're also going to be able to find it a whole lot better than maybe you currently, have defined it. So let's go ahead and get started. There's a couple of things I want to mention, but I also want to give you an idea of how I treat trauma. And I'll start with that, and then I'll end with what it is. So I've been in the field for 11 years now, and I've worked in a variety of capacities: schools, mental health community centers, hospitals, walk-in clinics. I've also worked in crisis hotlines. I've also worked in nonprofit organizations, RTFs, residential treatment facilities. And the last place that I worked was a, I can't think of what it is, a partial program. Partial programs are typically all-day programs where clients come and they learn some things about their mental health. They get seen by a doctor as well as a therapist, and then they go home, right? They don't stay there. So I've worked in a variety of capacities over the years, and I decided about 5 years ago to get certified in trauma. I realized that a lot of my clients were coming to me with severe difficulties, and I wasn't trained or equipped to handle it. I didn't fully understand it. And so I decided to, pursue a certification and get trained in trauma therapy. And so 5 or 6 certifications later, I'm doing videos to kind of help you understand what it is. So the way that I tend to treat trauma is this way. So after graduate school, I kind of honed my craft. I knew that, that I wanted to work with families, children and adolescents, but I didn't really have a specialization at the time. And so when I jumped into the field and I start seeing a lot of sick kids, so kids who are really ill, they're hearing and seeing things that aren't there, they're being abused and neglected, I thought, you know what, I bond with these kids, the kids seem to bond with me really well, I need to pursue a specialization. And so that specialization became children, adolescents, and families who were dealing with trauma. So I really narrowed down my specialization, and then I honed my craft by pursuing those kind of cases only over the past 5 to 6 years now. So within my 11-year career. So the way that I deal with trauma is, step number 1, I love to build the relationship. I think that when you're dealing with families who are traumatized and they're trying to heal, that relationship is 100% important. If you don't have that relationship, what do you have? So I like to build the relationship, and I'm not just saying build rapport, make sure we can talk together, laugh together, and get along. I want to make sure that we click, and I want to make sure that we click on multiple levels, right? Do you understand me? Do I understand you? Can I tell from our first encounter that we're going to make steps towards progress, right? There may be a little bit of friction, but can we work around it? So I like to build that relationship, and I build the relationship from the moment I talk to you on the phone, and then I continue to build that relationship over time. You don't want to get into a habit of, feeling like, well, this client has seen me for about 6 months now, I think I can not worry so much about the relationship. I think the relationship is important the whole time that client or that patient is with you. So I build relationship. The second thing that I do is I fill you with education, right? So I build you with education. I want to know what is it that you don't know, and maybe I can help you understand it. And so I like to give education. I call it psychoeducation. And I teach you about what you're going through. I teach you about what you might go through. I teach you about the mental health system and what to look for. And then I also provide a foundation of confidence by giving you that knowledge. So building rapport, psychoeducation, and then the third step is tools. And so the way that I like to help you build tools is by helping you build insight first. Because if you can't see yourself, and if you can't see what you're going through, what are you building with tools and techniques? So the third step of my process with patients or clients is building insight. And that might take multiple sessions of talking and examining and picking and pulling things apart and journaling and kind of exploring and verbalizing, right? Once that process is done, then we can start talking about the tools, right? So meditating and journaling and, challenging inaccurate thoughts and practicing, skills discussed and talked about in therapy. So it's a whole process. After that process of building tools, then we talk about post-traumatic growth, and that's resilience and figuring out how to maintain healthy lifestyles, right? So eating good, sleeping good, exercising, meditating, relaxation, just self-care stuff, right? Keeping yourself knowledgeable and educated, keeping up your yearly physical appointments, right? So that's the process of how I treat trauma. How do other people treat trauma? Well, who knows, right? Who knows? I'm not familiar with, how other people in my field treat trauma, but what I can say is most trauma therapists usually focus on, here's number one, neuroscience, right? So you're going to get a therapist who is knowledgeable about what happens in the brain when you are traumatized. What's going on in the brain now that your world has been flipped upside down? What is going on in the brain now that you're having nightmares and flashbacks and you're uncomfortable and you're afraid and you're depressed and you're anxious? So the benefit of having a trauma therapist is that most of them, I can't speak for all, but most of them are going to have knowledge of neuroscience. The other thing that they're going to have knowledge of, number two, is physiology. They're going to have knowledge about the central nervous system, the autonomic nervous system, the amygdala, the limbic system, right? They're going to have knowledge about what happens in the brain, what happens in the body, what happens to levels of cortisol, which is a stress hormone, and I've talked about it a lot on this channel. They're going to have knowledge about what actually goes on in the body when someone is experiencing trauma. The other thing is that they're going to have trauma therapists are going to have what I call integrative principles. They're going to know how to pull in concepts and pull in therapeutic tools to offer you. They're not going to just stick with one narrow view of your issue. They're going to be able to pull in what you need so that you can heal. And last but not least, trauma therapists typically are trained to understand family dynamics. They want to understand, how does the family operate? Is this family coping, or are they floating, right? Are they barely rising above the water, or can they swim, right? So trauma therapists typically are trained in family theory or family therapy, and they have the skills and the tools needed to actually help you figure out what's going on in your family system, what went on in your childhood, what's going on with you now that may have some ties to your family or to your childhood. So when you think of a trauma therapist, I want you to think of, I think I have 4 things here. Yes, neuroscience, right? They're going to understand what's happening in the brain. Physiology, they're going to know what's happening to the nervous system. Integrative principles, they're going to be able to pull in techniques from a variety of places to help you. And then number 4, they're going to have knowledge of family therapy and family dynamics. So when you pursue a trauma therapist, you want to be able to ask them, well, how are you going to treat me? Well, you want to know, do you understand what's happening in my brain? Do you understand what's happening to my stress hormones and my body? Do you understand how to pull in multiple techniques and multiple providers to help me? And lastly, can you help me figure out the family dynamic and explore whether or not this has had some influence on me as a person? All right, guys, thanks so much for being with me today. I hope this video is pretty short. I think it was just at 11 or 12 minutes. I'm not sure, but I'm trying to keep these videos short for you because I feel like you get more from short videos. So I'm going to keep them coming. Keep your comments coming, guys. I also ask that you hit the thumbs up button if this was helpful to you. Comment in the comment section below. Let me know if this was helpful or not helpful, guys. And I will tweak these videos to give you what you need or what you're looking for. So just let me know in the comment section below. I ask that you hit the subscribe button as well if you're not subscribed. If you are, thank you, guys. If you're not subscribed, I ask that you hit the subscribe button because then that way you can keep up with the videos that I post every week. I post Mondays and Fridays. Sometimes you'll get a Wednesday video as well as a bonus. All right, guys, thanks so much. I'll see you soon and enjoy the rest of your week. Bye-bye.